BSI, my scene is safe. We are responding to a call for a 28-year-old female victim experiencing chest pain. I will be calling for ALS and update any responding units of my location and situation. So, hello, ma'am. My name is James. I'm an EMT. Could you tell me your name? Freya? Okay. And do you know what time of day it is? Okay. Do you know where you're at? Okay, and one last question. It might seem silly, but do you know who the President of the United States is? Okay. All right, good. My patient is ANO times 4. So I'm just going to move on with my assessment. So I'm just going to do some checks on you, ma'am. I just want to make sure that everything's functioning properly and that, we're making sure we see everything before we get you on the move to the hospital. So could you open your mouth for me? Just say, ah. Okay. My patient is showing a open, clear, maintained airway. Appears to be self-maintaining, so I am not going to use an OPA or an NPA. Moving on. I'm going to check my patient's breathing, so I'm going to palpate my patient's chest. Okay, I'm not feeling any deformity, crepitus, or anything, not seeing anything that's concerning. The breathing, respiration appear to be normal on my initial impression. Rise and fall of the chest is present and adequate. Not seeing anything rapid or no hyperventilating, anything like that. So I'm also going to listen to my patient's lungs to ensure that I'm correct. All right, ma'am, I'm just feeling around here. Just got to check your lungs, making sure your breathing's okay. Patient's lungs, bilateral and clear, are bilateral and clear. I'm going to check my patient's circulation now. So, ma'am, I'm just going to feel around you and make sure I'm not missing anything here. Checking the voids. P. All right. Okay, no blood, no signs of any other injuries that are unseen. My patient's circulation seems to be okay. Pulse is strong and regular. The skin warm, pink, and dry, which is good. Okay. So, something I did not state initially is that this is a high priority patient due to chest pain. I will label this patient as a high priority and inform ALS units of this, and we will transport this patient rapidly as soon as we are ready to go. All right, ma'am. So I am just going to ask you some questions, and I just want you to answer honestly. It's not to investigate. It's more just to really make sure we get you the right treatment and get you to the hospital safely and quickly. So have you experienced this pain in the past at all? No? All right, well, when it started today, what was happening? What was going on? You woke up, and as soon as you woke up and stood up out of bed, you started to feel the pain? Okay. Now, has the pain gotten worse or better since we've arrived? It's gotten a little worse. Okay. On a scale of 1 through 10, could you rate the pain, 10 being the absolute worst? You'd say about a 9? Okay. All right. That's good. That's good. And just for, other reasons I got to know, or have you taken any medications today? Are you currently on medication? Antibiotics? Anything like that? Okay. No medications, nothing like that, but you were on antibiotics a week ago. Okay. And what was the antibiotic for? Ear infection? That's fine. Okay. And would you say the pain in your chest is radiating anywhere? And by that I mean, is it shooting down your arms, your legs at all? Is it going up to your neck, your back, anywhere at all? Pain anywhere else? In your shoulders a little? Okay. Down your arm. Okay. Good. All right. Good to know. Well, I'm going to continue moving. So, could you tell me the last time you ate or drank something today? All right. Is there any chance you might have fallen? No, you didn't fall, you didn't lose consciousness or anything like that? Okay. That is good. That is good. All right. Nope, stay here. Stay here, ma'am. Okay. Since we've arrived, has anything made it better or worse? Sitting in any certain position, laying down, eating or drinking anything? I know you said you haven't eaten or drank. Okay, so you're just sitting up. Seems to help a little bit. Not much. All right, that's okay. Thank you for telling me. And other than that, I believe I'm good with my assessments. So I'm going to move on to checking my patient's vitals. All right, ma'am. So I'm just going to go ahead and use my blood pressure cuff here, just wrap it around your arm, and I'm going to check your blood pressure and the rest of your vitals. It should only take a minute before we get you going to the hospital, okay? All right. Okay, the patient's blood pressure appears to be 120/80. Their oxygen level is at about 93%. I'm going to check my patient's respirations. Okay, we're at about 72 breaths per minute. I'm going to also listen to my patient's lungs again in 4 places. 1, 2, 3, 4. Okay. Lung sounds remain and are still bilateral and clear. My patient's pupils, based on what I'm seeing, are paral and dilating properly. Okay. And I think that is all I will be doing for this patient. So we're going to transport we're going to put the patient onto a backboard, apply high flow oxygen via non-rebreather at 15 liters per minute, and transport this patient rapidly to the nearest hospital while we reassess vitals and level of consciousness every 5 minutes. I will update ALS. And my general impression for this patient is a 28-year-old female, experiencing chest pain. Blood pressure is 120/82. Respirations are at about 72 breaths per minute. My patient's pulse is strong and regular, and we will be, and that will be all for today.